Today we're going to talk about some urgent and also some emergency cases, and I would like to show them with a simulation on this dummy you can see here, and also on the ECG monitor. We do have to the left side of me. And well, I would like to tell you about the complaints of the patient who showed up in the emergency room at Sunday morning at 8 o'clock. And he tells you that he has some palpitation for the last 2 days, and it is the first onset. His complaints are breathlessness on exertion, some palpitation, and he's also a little bit sweaty. Okay, these are the complaints of the patient. He came to the emergency unit, and you're the attending physician, and you show up in the emergency room and just look at the patient, listen to his complaints, and look at this ECG. Okay, on this ECG, as you can appreciate, we can see a fast heart rate. The heart rate is about 140. This is pretty high. The usual heart rate is, or the normal heart rate is between 60 and 100 beats per minute. And here we do have a tachycardia, probably it's a tachycardia, okay? And the second thing you can see on the ECG is that the distance between the QRS complexes are not the same, they're not equal. And the third thing is we don't see any P waves, okay? If we don't see any P waves, we don't have a sinus rhythm. This probably is not a sinus rhythm, okay? What can it be? It probably is an atrial fibrillation. In this particular case, it is an atrial fibrillation with a rapid ventricular response. Okay, that is why the patient is in trouble. All right, so we talked to the patient, we diagnosed his heart rhythm, and now we will try to therapy him. How can we do that? In this case, we do have two options. One option is the medical therapy. We can give him some medication to lower his heart rate. Okay, these are some negative chronotrope medication like beta blockers or digoxin. Beta blocker is the first line treatment here. It is your first choice. You will try to lower his heart rate to alleviate his symptoms. Okay, you may additionally give some digoxin. It has also some rate lowering properties. Or you can combine this medication. You can give this medication, you can applicate this medication on an intravenous basis, or you can give him as a tablet. Okay, this is our first option. The second option is an electrical cardioversion. That means you will try to convert this arrhythmia into sinus rhythm again. That is simply by giving him a shock. Just put the paddles on his chest, and then give him an electrical shock, okay? Then you will try to restore the sinus rhythm again. But there's a pitfall. What kind of pitfall is it, or what kind of complication can we have here? As you remember, I told you in the last lesson, if somebody has atrial fibrillation, there is no contraction of the atria, and the left atrium is prone to build some clots, some thrombus, okay? And if there is a thrombus in the left atrial appendix and you give this patient an electrical shock, you may dislocate this thrombus from the left atrial appendix to the left ventricle. From the left ventricle, it may travel to the aorta, and from the aorta, it will probably end up in a brain artery and cause some stroke. Okay, you wanted to heal the patient, and now you have a stroke. You're in trouble, okay? So what can we do to prevent a stroke? Somehow we have to visualize the left atrial appendix, if there is a thrombus or not. How can we do that? We can do that with an imaging method. The device is called the transesophageal echocardiography device. You let the patient swallow a probe, and then from the esophagus you can see the appendix and also the left atrium properly, and diagnose if there is a clot or not. If there is a clot, you mustn't do any electrical cardioversion. Okay, that is a caveat. Okay, that is not allowed to do. You give the medication some rate lowering medication. You give the patient some rate lowering medication, and you also give some anticoagulant therapy. And wait until this thrombus resolves, okay? If there is no thrombus, If you don't see any thrombus on the transesophageal echocardiography, you can perform an electrical cardioversion safely. All right, did you understand?